Clinicians love it. They call it the shot in the arm in their career because patients just literally can't believe. And that's what I tell my patients, because they all come in with these MRIs, most of them come in with these MRIs that say herniated disc, herniated disc, herniated disc. And then I open up their SI joint, and when I did, then their pain relieves immediately. This is not a quick fix. If you're looking for a quick fix, you're in the wrong place. I can relieve your pain, but we got to make it stay, you know? Yo, everybody, what's up? Physical therapist Dr. Ryan Whelton coming to you from just outside the beautiful Tampa Bay area. If you are new to following me, I am a physical therapist. I have a clinic where most of my patients have typically failed everything type clinic, and I've learned to get exceptional results in those patient populations. And the kicker is I develop protocols. So I do the same protocols with each diagnosis. I published a lot of protocols in peer-reviewed journals, and you can find it on my website, wheltonmethods.com. Now, if you can also take my courses, I have my courses, which my rehab results course, which is all my protocols. Everything's online. And then I have my myofascial courses. Clinicians love it. They call it the shot in the arm in their career because patients just literally can't believe. You can't believe that, you stimulate one area of the body, but pain in another area of the body goes away type thing. They call it the F-bomb method because patients drop F-bombs in the middle of the clinic like, what on earth just happened type thing. So anyways, I got that, and then I got my other immediate relief course, Sciatica, cervical, radic course, which is a circuit of points that I found. And then I have my rehab results, my cash-based business model course. So most of everywhere I went in the country when I used to teach live in person, someone would come up and ask me how to open and run one of these clinics I have in Tampa that doesn't take insurance. And I'm not interested, more of a clinical guy. And anyways, over the years, I thought about it, and I was like, you know what? If I can teach them how to show these chronic pain patients what's actually wrong with them, like marketing wise, and show them how to bring them in, then they can help these people that have given up hope, So anyways, I created a whole course. And I also have my VIP membership model. So I am going to start teaching live again, okay? And you can sign up on my website where either, depending on which level you choose to do it, we do either in a group setting where there's a group of physical therapists or chiropractors or athletic trainers or whoever. I even have MDs that do my courses or belong to my groups, or all the way up to one-on-one mentoring from me. So really, really cool. I'm really excited to get to know everybody. It's been years since I've interacted, other than just on social media, interacted live with my colleagues. So I'm really getting excited. I'm really excited to get to know everybody and learn what your frustrations are in the clinic, and maybe I can help. So another update is I actually emailed the journal. It used to be Journal of Practical Pain Management. Now it's Med Central, that I publish root cause of SI joint dysfunction, root cause of sacral torsion, shear, anterior sacral tilt, root cause of plantar fasciitis, and then the posterior shoulder impingement paper. But I asked them, I said, can I put more clinical guidance for different orthopedic conditions to help my colleagues in these? And they were like, yeah, sure, whatever. So they've been really good to me, that journal. And I just finished writing up a bunch of conditions and how I recommend treating it. And that will go live. So check my website, wheltonmethods.com, go to publications, and I have my peer-reviewed publications in there. And check, should be at the bottom. I asked them to put it at the bottom. So we'll see. But anyways, that should help in the clinic. My goal is to help people help people. So today I just evaluated a 30-something-year-old female. And she walked in and she said, I don't understand why I had to drive an hour to see you. I've been to like 3 different physical therapists and nobody even knows what's wrong with me. And she's like, I don't understand this. Why I have to drive an hour to see you. Now, I looked at her intake form and she had her back marked off. And in my clinical experience, and a lot of yours who have told me, that when you see the entire, someone's back pain and they've tried physical therapy, chiropractic, injection, surgery, all that stuff, right? And it fails, I find, and in my root cause of SI joint dysfunction and sacral dysfunctions papers, that it's actually that, okay? And that it got misdiagnosed, and that was the problem. Now, the reason why she had to drive an hour is not because I'm special, is because the therapist didn't read my papers that she was working with. If they had read my papers and implemented my protocol, she would not have to drive an hour to have an accurate diagnosis and treatment for what is going on with her. Okay, now she has herniated discs at L5, S1. Okay, central protrusion types. Okay, so I find central protrusions, I wrote it up in my paper, usually hurt in extreme extension, and they point over a vertebrae, right? But sacral shear pain can hurt right in that area too. So you can't really go off of that, especially down in the lower lumbar spine. Sacral shear pain can actually cause pain up the vertebrae. I've seen it. Achiness across the back, hurts in sitting, extension, flexion, as well as SI joint dysfunction can cause all that kind of stuff too. Sacral shear, read my paper, comes from a sacral torsion, okay? And it causes a shearing pain at the base of the spine that you cannot see on imaging. So these people were screwed, okay? They show up here constantly, like literally every day. I evaluate someone, SI joint, sacral torsion, sacral shear, and they have failed this, that, the other thing, okay? Now, what was interesting about this case is I've been doing this a long time, so I know how to troubleshoot my evaluation procedures. And so when I evaluated her, I asked her to extend back, and when she did, my left thumb translated superiorly on the PSIS, and my right thumb translated inferiorly, okay? So that told me she had an upslip of the pelvis on the left side. So instead of going down, it went like that, okay? So I pulled on her leg, and I brought that back down into alignment, and then they were both dropping. No more prone press-up test positive, okay? Now, what and you read my paper, SI joint dysfunction I wrote is caused by an upslip and or out flare of the pelvis, okay? So I pulled on the leg, brought it back down. I laid you on your side, and I gapped it open like this, okay? And when I gapped it open, her out flare, she stood up. She still had the pain in extension, and in flexion felt a little bit better. So then I put a ball between her knees, okay? Put a ball between her knees, and that further opens an out flare of the pelvis, okay? So we went like that, open up an out flare, and she was able to go extension, flexion with less pain, but said it's a little bit there, And when I first evaluated her, I evaluate the PSIS to find out if they have upslips and out flares, all that. But I also put both of my thumbs right here. You can do it in standing. Some people say they can't figure it out in standing, but I wrote it up in my paper. You can do it in prone too. You just have to make sure their glutes are relaxed. And when she bent forward, my left thumb went like this, okay? Translated towards the anterior aspect of her body, which told me she had a sacral torsion, okay? And you can check yourself by putting them in a 90-90 test and testing their strength. And almost every time the right side, I find, is the weaker side. If you're gonna say that the sacrum is rotating the opposite way, where your right thumb is translating, your right thumb is translating to the anterior aspect of the body, and they have a left weak piriformis, send me the video. I want to see it. Because I've been doing this years, and it's always one side with my patients, and I do thousands of these. So, So in her case, I realigned her sacrum. I was pushing like this, okay? I was pushing like this, and I realigned her sacrum. And I thought I had it. So I had her stand up, and I had her squeeze the ball and bend forward, extend back. And she said, it's almost completely gone, but still a little bit there. I said, where? She said, right here. So then what I did is I applied overpressure, thinking it was still SI, because you can get the pain pattern of SI that I published over the spine and sacral. So I went like this, and she's like, no, it's still there. So then I had her lay down again, and I pushed more on her sacral torsion like this, that way, down and that way. And when I did, and then she was able to bend forward. So sometimes, a lot of times it's extension, but sometimes it's flexion that's causing a catching, a shearing pain, sacral shear, shearing pain in flexion, okay? And that was the culprit, okay? So I just didn't get it the first time. I had to do it again, okay? So that is what was going on with her. And everyone told her that it was the disc, but it wasn't the disc because I didn't touch her spine today to get her out of pain. And that's what I tell my patients, because they all come in with these MRIs, most of them come in with these MRIs that say herniated disc, herniated disc, herniated disc. And then I open up their SI joint. And when I did, then their pain relieves immediately and rotate their sacrum back. And I'm like, no, you have a herniated disc. No one's arguing that. But I didn't touch your spine today. All I did was touch the innominate of your pelvis and it opened, and then the pain was gone. So how could that be that, right? I also evaluated a patient today that had pain in the SI area down here, and then went into the toes. And she had an L5 S1 herniated disc, okay, on her MRI. Makes sense. Everyone's tried to help this woman, type situation. Nobody can figure it out, right? So when it goes into the toes, I always ask that, does it go into the toes? And she said, yeah, it does. So I'm definitely dealing with a nerve root issue. But she says, it kills me in my calf here, and it kills me coming down the back of my leg and up in here, right? The buttock. So I want to see if this is compounded, if this is SI referred pain with sciatica, true sciatica. And so I pulled on her leg and gapped open her ASIS, like I show in my YouTube channel, Whelton Methods. I go much more in depth on Spotify too. You can watch me do it. And then I had her stand there and squeeze a ball. And I asked her, did your pain relieve down your leg? And she said, yeah, it's totally gone. She did not come in with the toes today. So when I was done with her, when I was done assessing her, I said, your back pain, okay, your buttock pain, your back and buttock pain, and the pain down your leg, the pain into your calf, your lateral calf, and is all from SI joint. Okay, it is not from a herniated disc because I didn't touch that. All I did was realign your SI joint today. I said, but you do get numbness in the fourth and fifth toe. So I said that is not SI joint. I said, but that's not your major complaint. She said, no, it's not my major complaint. She's like, that just intermittently happens. And I said, okay, so I'm dealing with two different issues, which we deal with a lot. We deal with mechanical back pain, SI joint, sacral torsion, sacral shear, and then also true sciatica, okay? So what my plan is with her is to put her on my SI protocol, okay, as published, okay? Read my paper, wheltonmethods.com. So I'm going to put this patient on my SI protocol to address the SI pain as well as the referred pain down her leg. That wasn't sciatica, that was SI referred pain, even though everyone told her it was sciatica and it made sense on an MRI. And then I said, for the fourth and fifth digit, what we're going to do is loosen up your piriformis very gently. Loosen up your piriformis enough that we can take that. I said, I can't fix that disc, but what I can do is I can try to move the spinal nerve and give it some room to breathe, okay? And also any entrapment in the piriformis, when you loosen up the piriformis enough, then I find that helps with treatment-resistant sciatica. Now, this is one of the things that I wrote a whole thing about that I submitted to the paper for republication for clinical guidance that should be out soon. Is sciatica. When you treat it, it's a dance, okay? And I tell all my patients up front, when you have true sciatica and you're stretching the piriformis or doing the lower trunk rotation, you are creating neural tension, okay? Now, when you have somebody that has a herniated disc and they do the slump test, like me one time, they can't extend I could only do this. And it was such severe tension in the back of my leg, pain in my back, that kind of thing, right? But when you're doing the piriformis stretch, you're doing the same thing. You're stretching the sciatic nerve. And when you're doing lower trunk rotation in my SI protocol, you're stretching the sciatic nerve. So you're creating nerve tension. So the question is how do you stretch a piriformis muscle or the lumbar paraspinals without creating nerve tension that is going to exacerbate the pain? Like it's like doing the slump test to somebody that has a peripheral nerve injury. That it's going to hurt, you know? So I tell all my patients up front on camera, so they have to listen to it again because people forget what you say. That I say every year when I treat patients just like you, I say 80% of people go too far and flare it up. I say 20% don't. They just go nice and gentle with the piriformis stretching, and they don't go too far. Okay, and I said be the 20%, not the 80%. Okay, but you don't know what you don't know until you know it, and then you'll never do that again. Now, this is very important. Number one, so you don't flare up their sciatic nerve, but number two, compliance. If you don't warn people, I found in business, as a clinician and in business, if you don't warn people about the possibilities that could happen to them, meaning that you could flare up your sciatic nerve if you pull too hard, then they're pissed at you. And they say that you don't know what you're doing and that, you hurt me. When in reality, they pull too hard, right? So I always warn them about this on camera. So when it happens, because inevitably 8 out of 10 of my patients do it, I can say, remember we talked about this on camera, right? And they say, yeah. So it's a way to increase compliance because those people used to quit on me and be like, oh, this guy doesn't know what he's doing. But when I started doing it this way, then it's just like, oh yeah, you warned me about that. Okay. So the sciatica, I've taken people, I had this one guy that people say they're in 10 out of 10 pain. This guy was in 10 out of 10 pain. I was shocked I even agreed to treat him. He was writhing on that mat, just like, like with severe sciatica down both legs. I told him, I said, we have to loosen up your piriformis muscle significantly. I said, but you're in so much pain that I'm not too sure you can actually do it, without creating too much nerve tension, right? And it took us 6 months, because that's what it can take, especially in men with tight piriformis muscles. It took us 6 months, and he flared it up a few times. And I said, and this person was told that by a surgeon, there's no amount of physical therapy you could do. You need surgery for these herniated discs, spinal fusion surgery. And I said, if you don't have myotome weakness or bile or bladder issues, then it's not an emergency, and I said, we can try this. So anyway, so when he got this down to here, this guy was walking around flea markets. He had no more sciatica. So we decompressed the sciatic nerve. But it took 6 months, and there was multiple exacerbations during that rehab. He's actually on my YouTube channel. You can watch his testimonial. And the surgeon said that's not possible to be done. And I said, we can give it a shot. It works for me, I find, in my practice most of the time. But to loosen up a piriformis that slowly can take time. And you need to warn patients, because patients don't want to do 3 months of rehab and may take 6 weeks, 8 weeks to start noticing a difference like that or flare it up. They don't want that. They want quick fixes. But you need to explain to patients, I found over the years, that this isn't I tell every patient up front, this is not a quick fix. If you're looking for a quick fix, you're in the wrong place. I can relieve your pain, but we got to make it stay. And that involves structural changes, stretching muscles, strengthening muscles, rebalancing your pelvic, your pelvic area, stretching your piriformis to the length that will decompress your sciatic nerve. And because you have to tell them. And if you don't tell them up front, they quit. We live in a society that wants quick fixes. This is not a quick fix. Physical therapy generally takes time. So anyways, that's that. So the moral of today's story is recheck the sacrum. I've learned over the years, sometimes I didn't rotate it back all the way. And if you don't rotate it back all the way, the person can still have pain at the base of their spine and flexion. Okay? I thought it was SI that I was missing, but it turned out to be a sacral shear. So I just rotated a little bit more, pain was gone. Okay? Sacral shears can be tricky, but if you know what you're doing, and I published it, then you should be able to help these people. And this woman should not have to drive an hour to see me and fail 3 physical therapists because My SI paper has been published for now 5 years, over 5 years. I published it in 2020, it's 2025. And they say it takes 18 years in a medicine to hit mainstream medicine, but I say we can't wait that long. And I find that tragic anyways, because in business it happens like this. AI, like these marketing companies are all over it. Why? Because they're going to go to business. You know, us, we still keep our job, right? So stay up front on new techniques and treatments, and you will help a lot of people, well, more people than you would have if you didn't, you know? Anyways, that's that. Peace. Love you all.